Hi everyone, welcome back. We're going to start up week 3 videos. I thought we would start with chapter 6 with the chart. So on the main adult ed iLearn page for allied health, we're going to go down and scroll down to chapter 6, which is right here, or you can always access it through the 3-bar menu over here on the left, and it's right there as well. So we're going to start on chart 7, because last week we had chart 6. So let's do this. All right. So now, on here, the L, it can be a capital or a lowercase. Generally, you'll find it used more in the uppercase form. This is a liter. This is 1,000 cubic centimeters or 1,000 cc's. Or it can be also titled as 1,000 milliliters as well. Next, we have the lab, L-A-B, with a capital L. This is laboratory. This is generally where we put down some experiments. All right. Next, we have pound. This is our measurement for weight in America. Everybody else is on kilograms, and we have pounds. There's 16 ounces in a pound. And I don't know how many pounds in a ton, but 16 ounces in a pound. Okay. LTC, all capitals. This is a long-term care facility. So this is like a nursing home, assisted living facility, maybe some sort of rehab facility, all labeled under long-term care. You're there for more than a short period of time. It doesn't mean they don't accept short-term patients that are only there like a few days or a week, but generally you might have residents that stay there for months or maybe years. LDL, this is a low-density lipoprotein, so we consider this a more unhealthy cholesterol. It contributes more to cardiovascular disease than HDL, which is the other one, the other type of lipoprotein or cholesterol. All right. LG, this is large. You probably see this on your clothes if you look for the right size. They come in small, medium, and large. Large means big. Liquid. So this, right, like water. Water is a liquid. Juice, milk, liquids. LLQ. So if you remember back to chapter 7, section 2, when we talked about the abdominal quadrants and like left upper, left lower quadrants, right upper, right lower quadrants, and they're annotated by LLQ, LUQ, right UQ, or RUQ, RLQ. Okay. Last menstrual period. So this is really important when they start to look at female problems. So when was your last menstrual period? This could mean your last cycle. Everything else is really hard to track with a female cycle. You have to take blood work. We have to measure hormone levels. So it's really a lot easier to determine a date than it is to determine hormone levels. So when they start looking at how far along you are in your pregnancy, that kind of thing, they'll try to figure out your last menstrual period. LOC, it can mean laxative of choice. A laxative is something that loosens your stool and allows you to have bowel movements easier. But mainly what I see LOC used for is level of consciousness. Level of consciousness. So are they alert to painful stimuli, right? Do you have to like pinch them or sternal rub them in order to get a response from them? Are they alert to verbal stimuli where you can talk to them and then they open their eyes and look at you? Or are they just alert? Are they up, looking around, and alert? LP, lumbar puncture. So this is where they go in through your lumbar vertebra into the lumbar section of your spinal cord, and they withdraw spinal fluid, cerebral spinal fluid, also known as CSF. This is a tricky procedure. They have to be very precise, and everything has to be very sterile. They do that to check for like viral meningitis and some other neurological viruses or bacteria. LPN, you learned this in the first semester of Allied Health. So this is a licensed practical nurse. The equivalent is also called a licensed vocational nurse, which is an LVN. Mainly you're going to see the LPN abbreviation used. Because LVN is right there. Look at that. Oh, man. Okay. So this is kind of like a career tech ed level of training. So it's not quite an associate's degree because an RN is an associate's degree. An LPN or an LVN can do the majority of what a nurse does, but they have to work under a nurse. They have less training. They have about a year of training. Okay, LUQ, this is the left upper quadrant, right? Just like LQ is left lower quadrant, this refers to your abdomen. Okay, we already talked about LVN. All right. Then we have MA. This is a medical assistant. This is a career tech education, an HSTE program. Takes roughly 6 months to a year, depending on what kind of program you go through. And medical assistants are very versatile. You can specialize in more of the health informatics side of things or patient care. Or you can even do lab work, right? Tomato, tomato. You can do a lot of things with the medical assistant certificate, and they're in high demand. MAT, now this is with a capital M. This is maternity. This means the time that you're pregnant, right? Like maternity clothes or clothes that you wear while you're pregnant. MCG, this is a microgram. This is a unit of measurement. With medications, you'll find dosages could be measured in micrograms. MCG, very small dosage. MD, so this has a few different meanings. If you're talking about a person, as in a job, you're talking about a medical doctor, like a family practitioner is an MD. If you're talking about a disease, you're talking about muscular dystrophy, which is where your muscles are not coordinated. It's very difficult to build up strength and coordination in them. Myocardial disease, that's a disease of the myocardium in your heart, which is your heart muscle layer of your heart. Med, this is short for medicine. Like aspirin is a medicine, ibuprofen is a medicine, so on and so forth. mg, so this is milligram. Milligram is a unit of measurement. There's 1,000 milligrams in a gram. Okay, so you might be familiar with this if you were born and raised in the Eastern Hemisphere, where they don't necessarily use ounces and pounds and whatnot. Oh, come here. Come on. Come here. This is Milo. Yep. It's time for bed. Anyways, so if we go down one, it's magnesium. Now this is very important with muscle contraction and relaxation. So when you're having issues with your muscles cramping, one of the best things for you is magnesium, because your muscle cells have to have magnesium in order to expand and contract. Okay, so if you're deficient in magnesium, that's a problem. So we know this is an element because it's a capital M and a lowercase g. That's a huge tip-off. Not always the case, but in this case, it's a good indicator. So I want to Stop with magnesium, and we'll pick up with the next video to go through the rest of it.